I witnessed, recorded, and produced these videotapes of the Washington, D.C. hearing. Their authenticity is above question.
This is produced as part of the ongoing work on the website, thewaythetruthandthelife.net.
This is a hearing about the government licensing the electrocution of people to cause grand mal seizures. Think of the millions of dollars, taxpayers' money, spent to pay psychiatrists and their supporters and for the worldwide travel in putting this conference together, while the victims and opponents had to pay their own way.
Dr. Breggin.
I want to show appreciation to the panel for honestly working on the issue of memory deficits and for honestly describing the confusion of the state. Too often these issues have been glossed over more so, and I really do want to show some appreciation for your working on these issues. I think it's an advance in psychiatry to have these things written down. This is the area that you asked me to testify on, and I do have one specific area where I feel that my lengthy testimony was simply disregarded, so I'd like to take a minute and just review it. And that is your statement on page 9 that neuronal death has not been detected in animal studies. This is simply false. We have several excellent studies, and if you would like me to review them more or ask me about them, I would. But it flies in the face of the study by Hartelius, which is book length with controls, which shows cell death. It flies in the face of studies by Breggin and others at the Columbia Psychiatric Institute, which show cell death and which show hemorrhages. Since I was asked specifically to testify in this area and written a book about it and review the study, I would hope that at best that sentence would be deleted since it's false. I would prefer to see the statement that they do show cell death. If any of you would like to discuss that issue with me briefly when I'm done, I would be very happy to do that. In general, I affirm Dr. Squire's changes, some of his changes. I'd like to suggest one minor but important one, and that is you state that many patients complain that their memory is not as good. In medicine, patients complain and doctors report. I would like to see that change to patients report.
What page?
Page 8. Page 8, fourth from the bottom, many patients complain. Complain is a pejorative word in the dictionary. If you looked it up, it would not give much credence. And you can tell that the patients in the audience appreciate it. Now, I'd like to make 2 suggestions on the memory gap issue that will be additions basically to the ones that Dr. Squire made. And I think they're very critical, but they're minor in language. On page 8, enduring and permanent memory gaps have been reported to occur for events occurring in a 6-month period before ECT. Even in Dr. Squire's work, that 6 months represents the mean or the average. I'm not sure which. The mean or the average. That means that the memory defects go much earlier than the 6-month period on your bell curve, even in his conservative research. So it's not during the 6-month period. It's either for a mean of 6 months, or more accurate, more easily, you might just say for a period of at least 6 months. This is quite critical because his research and others have clearly established that the 6-month period is the mean, and I've seen many patients with losses extending back a year or 2 or 3 that are quite significant. We've had testimony here from patients who've lost college educations. That's not inconsistent with a 6-month mean or average. It is inconsistent with a 6-month period. And similarly, the retrograde amnesia and for the 2-month period after treatment for anterograde, it should be for at least a 2-month period. The 2 months is again a mean or an average, as far as I understand it. And perhaps that's why I could exchange briefly on that, since he's come up to the microphone.
I think I get your point. These were median figures representing 50% of patients reported more, 50% less. So I think the terminology at least would not be appropriate because after all, half of the patients reported
Dr. Lutz would like to respond to Dr. Breggin's discussion of the neuronal cell death.
We considered the weight of all of these studies, and I think the sentence preceding what you stated sums up the feeling or the consensus, and that is that in looking at the studies that have been controlled for a number of problems, there is no convincing evidence for neuronal cell death.
May I ask directly if anyone on the panel has read Bartellius' book-length report? Direct question. Has anyone on the panel read Bartellius' book-length report?
Well, I think it's very difficult to out of the hundreds of studies that have been done, to use what I would consider a very selective critical review, and certainly there are a number of studies and findings recently, Meldrum and others, and all kinds of species of animals, that I think outweigh the evidence of a single study which was done at a time when there were problems with methodological results.
There are no studies after that other than the rat studies by Meldrum, and not on a variety of species. We are weighing one series of rat studies against trained, highly qualified investigators in Colombia on monkeys. Bartellius is extremely good on cats, against no other studies other than rats who are notoriously insensitive to hypoxia. I really feel that in the interest of scientific accuracy, the statement should at least be deleted.
I think we'll have to move on to if there's any other.
One electroshock treatment can equal the energy of 3 pistol shots to the head.
Dr. Rose accepted 2 pieces of literature for reference. I would hope and might make copies available for the panel. We're talking about having at least accurate information on the device and what we're using. And the one copy is the Thymatron, the brochure on a single sheet handout on the Thymatron pulse ECT device. And in there it shows the physical characteristics. The other, and pardon me for the emotional content of it, I also included a current Winchester ammunition catalog because it shows the energy with which the bullets have. Now that's emotional, and I don't really want to bring that up. But running this machine at its maximum brings 201 joules of energy. That is 148 foot-pounds. If you're interested in actually understanding like the truth in landing, what they're talking about, 1 joule is 0.07376 foot-pounds. But what this means is this device, when operated at its maximum capacity, will lift a 1-pound weight 148.7 feet. The energy contained in that is equivalent to 3 25 caliber pistol slugs. Now that's almost instantaneous entering the brain. This takes a half a second. Now that is just pure factual data. To give that lifting of 1 pound energy equivalence in informed consent, how could you not do that? And if you're going to give a procedure, the total energy and the total time are the physical parameters that characterize the device. How could you not include that information? And if a doctor prescribes a drug, he has to record the prescription. Why isn't the total time and the total energy recorded? This has been an experimental hazardous device for years now. Why hasn't this information been gathered that we could be talking with concrete, objective facts rather than subjective opinions of psychiatrists and patients?
One electroshock treatment can equal the energy of 3 pistol shots to the head.
All right, out with your gum. Huh? Out with your gum.
Okay, this won't hurt. It'll be over in just a moment.
Uh-huh. What's that?
Conductant.
Oh, dab will do you. Right, Mr. Jackson.
Open your mouth.
What's that?
This will keep you from biting your tongue.
Well,
Now just bite down on it. That's right. Just bite down. Now bite down on it.
good. Are you ready?
Ready.